Hey guys, I've got a few updates. Number one, I've not contacted Dr. Golpa about the crooked bridge situation because, honestly, I don't really think that there's anything that they could tell me that would benefit me in any way via email, or phone. I think that in order to give me any definitive answers, they would have to see, the situation. Like, they can't really tell me what's going on over the phone or email. And, you know, with that situation, it's like this. I got the implants done. I won the contest. I've been back a few times and everything, but now it's time to be realistic here and find a dentist in Jacksonville. That is the only way things are going to work out for me is if I find a dentist here in Jacksonville. I'm not going to lie, I'm not very eager to do that right now, and it's terrible, but my first time trying to find a dentist here, and it was one that I thought was legit, that I had seen their commercials and everything like that, and they probably are. I mean, dentists are humans, they make mistakes also, but it to me, it just felt like I might as well have been driving down the interstate, rolled the window down, and just tossed my money out the window because nothing made any kind of sense. I got nothing. I got nothing out of that. Just it's a bad experience, a bad situation. So I need to find a dentist, and I can empathize with all of you that are struggling with that. It's not an exciting thing to have to do. It's not. It's dreadful. It's dreadful. Finding a dentist is a dreadful experience because you just don't know what you're going to be walking into. You have no idea. And so I'm just not looking forward to it. But it's something that needs to be done because, I'm very fortunate right now that everything is going all right, but there's going to be a time when it's not. And is that going to happen when I have absolutely no idea where I'm going to go, So I know this, and I'm just, I'm being lazy about it, and I need to knock it off and just go ahead and find a dentist and, not wait for something wrong to happen. Legit find a dentist right now and, get them to investigate the situation and, whatever. Hey, what's up? I'm Christy. How are you doing? You gonna be my dentist, that sort of thing. And just get it out of the way so that when a situation does pop up, I can call my dentist and be like, hey, guess what? I need to come in. So that's that. As far as how I'm doing, there's an issue. It's not major or anything like that. At least I hope not. I'm a hypochondriac, so of course I've ran through a whole list of possible scenarios that's going on. But what I think is going on is I probably got some food trapped underneath the bridge up here because it's all inflamed under there. It's inflamed. I had been noticing recently that it has been more difficult just in that particular area, nowhere else, just that area. I haven't really been feeling water pass through there with ease, So it's been hard keeping it clean, and I don't know. I guess it got really bad and started to hurt. So I got one of those little Dentech pick brushes that I mentioned in my Products I Love video. It's just a little plastic pick with a metal end, and looks like a scrubber. It looks like something you'd scrub a Dr. Brown's bottle with, as if you all know that. Yeah, looks like a miniature bottle scrubber. It's got the little bristles coming out, but whatever. And so I kind of picked around the edges, and I was able to get some stuff out, and that could be the cause. And it wasn't a whole lot, but I guess it was just enough to cause inflammation. So, gargled with salt water, cleaned that all out, picked that stuff out, used the water pick. Now water seems to be passing through there relatively easily, but it's inflamed now. It's kind of swollen, and I would show you, but you can't see it on camera. So I just need to keep it extremely clean, and if it doesn't go down anytime soon, then I'm gonna have to be going to the dentist or something, doctor, whatever. to see if it might be an abscess forming, and I pray it's not. I don't want to go through that. I really don't, especially around an implant. I don't want to think about that situation. So hoping that it's just, a little inflamed, because yes, if you don't get your bridges clean underneath there, like if you don't clean that area out very well, food particles can cause tremendous pain. It has happened to me before where food that I thought I had cleaned out had gotten stuck up under there and chilled for a couple of days, and when it comes out, it's just all painful. When you use the water pick on your normal setting, it hurts. You got to turn it down a little bit. I mean, that's what you need to understand. And so that's kind of like the drawback of having permanent bridges, is that you can't take them out and get them immaculately clean, and it hurts if you don't. So it's kind of challenging getting them cleaned. So that leads me to my next point, and that is that I'm pretty sure that I'm losing bone. And, to answer the question of whether or not implants preserve only the bone where you have the implants, or if it preserves the bone in like the surrounding areas, I mean, I think that it just preserves the bone where the implants are at, and then the surrounding areas continue to shrink. Because number one, my molars, I mentioned I got those pulled when I was 15 back here. I know it's horrific, but I did. And over the years, the spot where the molars once were just got skinnier and skinnier, and it sunk down, and you could tell it was a visible like dip in my gums, and that was from not having teeth in that location. So now where I'm at is that where it once was like kind of a challenge to clean under my bridges with the water pick, I would have to like angle it a certain way to make sure that I could get the stream of water going through there, because just the way that they're laid out and everything, it was kind of difficult. Well, now, like especially on the bottom, like right in the front, I can just stick the water pick right there, and the stream just goes straight through. I mean, there's nothing stopping it. So that is a very good indicator that I am losing bone in that area. Also, when I run my tongue around like the tops and sides and everything, the gap has gotten a lot bigger. It's really apparent that I'm losing bone in the areas that don't have implants. Now, the implications for that, I'm not exactly sure. I can imagine that it would mean that you would need to have your bridge replaced at some point, which we already know that they don't last forever, but it's not so much that the bridge is going to be like no good anymore. It's just that it's probably not going to fit. Kind of like the same situation with dentures. You can only get so many relines before it's like this appliance is not going to fit the situation anymore. You need to replace your dentures at that point. Same thing with this. There's going to come a point where the space between my gums and the bridges is too big, and I'm going to have to replace these bridges. As far as anything else, I don't know how I'm going to be affected by losing the bone in the surrounding areas. And then for those of you who think that I don't like my implants, let me just clear that up real quick, and I hope that I can convey this properly. I hope I can articulate it properly without it sounding bad. When I got my dentures, I was coming from a really terrible place. Like, I couldn't function at all with my teeth. Like, I couldn't smile, I couldn't eat, I was in a lot of pain, like 24/7. Like, they served no purpose but to make my life miserable. So when I got the dentures, it was like a relief, because I could eat again and I could smile again, and I wasn't in pain. And the pain that I did experience, I understood it, like, sore spots. I knew where they came from and how to solve it, and it wasn't really challenging for me. I mean, I'm really lucky. I'm blessed that I didn't have as many problems as a lot of people do have with dentures. You know, a lot of people have real, true struggles with dentures, and I didn't. I did really well. And so when I got the implants, it was kind of like I was plucked out of my comfort zone and put into some, new uncharted territory, where I was going from doing great to having to start over again. I was having to learn how to eat again because, it's a new setup, and chewing was different, and learning to talk, and saliva control, and just everything. I wasn't anticipating the level of pain that I had to deal with. There was challenges that I wasn't really prepared to deal with because I hadn't been experiencing challenges with my dentures on that scale. And that doesn't mean that the dentures were better, because I'm looking out for the long term benefits of having implants, not just for instant gratification. I know that having the implants will preserve the bone, and it will cause more stability, and it will be easier, and I don't have to worry about my teeth getting loose, and things like that. There's a lot of benefits. I just don't think that I was really fully prepared for the challenges that I was faced with in the beginning. It was definitely a learning experience, and I'm doing a lot better now, obviously. But yeah, it's perspective. You have to look at everything in context. When I had my dentures, life was fantastic because I was like so much better off than where I had come from. But like getting the implants, it was different. It was something different, and like I said, taken out of my comfort zone. I love the implants. So don't think that, oh, she's got challenges and implants just aren't worth it. I don't want to imply that at all, because I definitely think that it has been worth it. It's just, it came with its own individual set of challenges, and there's not really a whole lot of firsthand information out there from people who are going through this. With the dentures, at least I had a lot of feedback from people who would send me messages and stuff, and the forums, a lot of people on the forums to relate to. But with this, there's only like a few people. I mean, not a few people, but there's only like so many people that I'm in contact with that are like in the beginning stages right along with me with these implants. There's only like maybe a few that have had the all-on-4 implants for a long time that I can ask for advice from and stuff like that. So it's just a different experience. It really is. It's not like having dentures. It's not like having teeth. It's just not. It's totally different. And so that's why I hope that through these videos that you all will know exactly what to expect. Keep them clean, because this is really hurting. I mean, just talking right now, this area feels really sore. I'm starting to think it might be an abscess. So I need to handle that, obviously. But if you have any questions, hit me up at KAL32205@gmail.com. I will get to it. It may take a while. I'm still in the process, which I have been for like the past 3 weeks, of catching up on emails, and so I apologize for that. Anyways, I hope everybody is enjoying fall and the coming holidays and everything. And one more thing, remember when I told you all that I was pregnant with my daughter Nova? Believe it or not, she is about to be 1 in like a week. Isn't that crazy? Like, this year has just gone by so fast. She's walking and she's saying some stuff, and it's just crazy. It's really sad. So anyways, that's all I have for now, and you guys take care.